the Public Health Institute, focusing on the development of healthy community indicators. Thank you, Neil. I'll now turn it over to you.
Okay, great. God, with that introduction, I don't feel like I have anything left to say. So thank you very much. Okay, it's a real pleasure to be here with you all. I'm going to be talking about a tool that is really at the nexus of climate change, transportation, and public health. And this presentation is really geared to policymakers, high-level folks who are in a position to influence or adopt policy. So it's really to orient you to the tool and give you a sense of what it does. And also, so if your subordinates come to you saying, oh, you have results from this tool, you'll already know something about the tool and be in a position to understand the outputs. So my intro really is the framing of climate change as the #1 public health threat that's facing us as a state, as a nation, and as a planet. We know climate change has been labeled a threat multiplier, and it's probably no more graphic than with COVID, seeing how that plays out. We had these horrific forest fires over the summer, with the increase in number of smoke days on top of a pandemic. So our healthcare systems that were admitting people due to the smoke were already under the pressure of the pandemic. When people have to evacuate from those areas, the delicate task of keeping people safe in shelters and figuring out how they're going to be housed is yet another challenge. So this is just a very stark example of how these pandemics interact. We also have a pandemic of sorts with racial inequality that is also in the background, and we know that climate change is going to disproportionately impact disadvantaged communities. Transportation, California, as well as the United States, is now the leading sector for greenhouse gas emissions. It's roughly 40% of all greenhouse gas emissions in California. And the big question is, how can we reduce greenhouse gas emissions in the transportation sector? So a lot of the focus is on increasing the efficiency of vehicles and fuels and reducing vehicle miles traveled. But how we do it, as Linda intimated, could have huge impacts on our health and the kind of infrastructure that we create to promote health in the long term. So what are those health benefits or harms from these strategies, and the direction and magnitude of their impact? So what I'm now presenting is a very simple model of a health impact assessment diagram, where we have the transportation system in the middle, and through the little icons, biking, walking, and transit, you can see how active transportation increases physical activity. And the lack of physical activity has been strongly linked in many kinds of studies, including the randomized controlled trials with heart disease, stroke, dementia, depression, diabetes, and some cancers. It's estimated that roughly, 9–10% of all deaths in California, so that's on the tune of 20,000 deaths per year, are due to the lack of physical activity. So that is somewhat equivalent to one COVID pandemic per year that's been going on for decades, that obviously hasn't gotten the kind of attention that COVID has. But I just wanted to point out that this is a major public health issue that the transportation system plays a role in. The other pathways include road traffic injuries, through traffic collisions, through fatal and serious injuries. Other major direct impact is through vehicle emissions. So we have fine particulates, PM2.5, which are implicated in cardiovascular disease and lung cancer, and the carbon emissions through vehicles impacts our climate and the health impacts from that through indirect mechanisms. I also want to point out that there's a lot of other indirect impacts of the transportation system that people are probably well aware of. Just the ability to get your basic needs met through food and shelter and getting to work and education are all part of the transportation system that are part of the social determinants of health that impact people's longevity. Also, community severance, when highways are built through communities, It reduces the level of social capital that are in those communities. So there are many different impacts, but the ITHIM model really focuses on these direct impacts. Now, what is the ITHIM model? It is a scenario-based predictive model that quantifies the health impacts of active transport and other carbon mitigation strategies in transportation. As you can see in the photo, in the top panel, there's a notion of before and after. And that is that with a different scenario, a different vision of the transportation system through land use, transportation demand management, infrastructure, and policy, that we can really have a different configuration of the transportation system, and that travel behaviors are changed in that process. And in the bottom panel, it tries to indicate that it is a potential win for everyone with decreased carbon emissions as well as improved population health. What the Healthy Mobility Option tool does is it integrates data on health and travel. And through this bubble diagram, you see the ITHIM is in the middle of it all, but it intakes many different data inputs. And you can see the three main pathways: traffic injuries, physical activity, and air pollution. And you can also see the icons represent the many California data sources that are used to calibrate the model. So we can see that SWTR's data, Caltrans data, the California Household Travel Survey, the California Health Interview Survey, the MFAC model is used for modeling emissions, mobile emissions in California, the State Department of Finance for population data, and the scenarios, some of the scenarios we use actually come from the scoping documents and the strategic management plans of Caltrans. So the model takes these data, integrates them, and the outputs are health outcomes, the monetization of those health outcomes, as well as carbon emissions. So as I mentioned, the main outputs are in terms of annual number of deaths and a concept called disability adjusted life years. And what that represents is the number of years lost due to premature mortality, people not reaching their predicted life expectancy, as well as the time they are living with their disability due to a chronic disease. It's often that there could be decades worth of living with a chronic disease that impairs people's lives. And adding that into the mix is really important, because some conditions, like especially mental health conditions, don't necessarily kill a lot of people, but they create a lot of morbidity and illness in society that would not be accounted for if you only looked at fatal outcomes. The outcomes are broken down by age and sex, and thanks to the California Department of Public Health and ARB, we also can break these down by race and ethnicity and income level. So these are new additions to the model in the last couple of months. We also break it down by region, and at least 30 counties of the large metropolitan planning areas, and specific causes of death. So as I mentioned, heart disease can be broken down into several different categories, as well as the other outcomes. And it also breaks the outcomes down by the activity pathway, the health impact pathway. So you can see the relative importance of physical activity, fine particulate emissions, as well as traffic injuries. And that's helpful for understanding where, in fact, we might get the most benefits and where investments might be well justified for a good return on investment. We monetize the outcomes as well using two different methods: cost of illness, which is counting up the medical bills and therapeutic costs and all those kinds of things, as well as the value of statistical life, which is a regulatory mechanism that assigns roughly $9 million to a life lost, and then multiplies by the number of lives lost. And again, we also quantify car carbon emissions, because really we're talking about substituting walking and biking. And so it's really the car that is the focus there. There's a number of built-in scenarios that come with the model. They include state agency goals from the Air Resources Board and Caltrans. So again, this comes from the scoping plan, so a quadrupling of walking and transit, as well as a 9-fold increase in cycling. The Caltrans Strategic Management Plan 2020 has a doubling of walking and transit, as well as a 3-fold increase in cycling. Built-in scenarios also include national health goals. The U.S. Surgeon General's recommendation that adults get 150 minutes a week of moderate or vigorous physical activity is built into the model. And the recent regional transportation plan updates, these are the ones, the Sustainable Community Strategies, SB 375, from a collection of years from 2013 to 2016, again, for the largest 5 metropolitan planning regions. There's another set of scenarios that are really user-driven, and this could be used for grant writing and other things. What if we could only increase our levels of walking, our baseline levels of walking and biking by 5% or 10% or 50%, and you'd get an assessment of the number of lives or deaths averted per year using those kinds of strategies. Also, the fixed amount of time. Let's say you want to investigate what would be the effects of just having 15 minutes per person per day of physical activity through biking and walking, or vary the mix, maybe more biking than walking, or vice versa. So these are the kinds of things that the user, how they're interested, could drive the model. Also, replacing short trips. We know that most, a high percentage of trips are for rather short distances. So if we could just replace half of them with walking and cycling, what would be the health impacts of that? And again, we have other strategies that are really about altering the propulsion systems of cars. So lower carbon driving uses some projections from UC Davis, about a 35% reduction in CO2 from the 2000 baseline by 2045. It's not the carbon neutrality that is the real enchilada, but it gets us a significant way. So these are all scenarios that are built into the model. I'd like to quickly just go through some of the use cases where the model has been used. Policy education is a biggie. Myself, staff from the California Department of Public Health have testified in front of state legislative committees. We've held staffers briefing days where we presented the model. Advocacy groups have taken the results that have been published in peer review literature on the model and used that for their lobbying efforts to increase funding for active transportation. In addition to that, actual health impact assessments of city and state agency goals. These are things that the city of Los Angeles, through the Los Angeles Department of Public Health, has done. And there's been projects by the California Department of Public Health looking at SB 743 and what the impacts of different strategies for reducing VMT might look like as well. On a very practical level, MPOs, virtually all of them, all the large ones in California, have used the model in one way or another. Some of them are into a routine mode. Some of them, like the Metropolitan Transportation Commission, is already on the 3rd cycle of using ITHIM to quantify some of their goals. And they use it in several different ways. One is to quantify their the health impacts of their major alternative scenarios. Another way that they use it is to look at prioritization of projects. And again, this is for system-wide projects. So if you have a large investment in a regional mass transit project, ITHIM has actually been used to quantify the health benefits of that. Although I'll talk about the limitations about getting down to very small projects where the model really is not the best fit. It's also been used in a research mode, and recently we've published, some colleagues of mine at UC Davis have looked at what the health impacts of autonomous vehicles are. So you can see that the model is broadening out in a number of different settings, including 7 different states now are using the model. Several of them are embedded in their Department of Transportation and State Health Department. So Oregon has been using the model for, I don't know, probably 7, 8 years, where on an annual basis, they run their state plan right through the model to see what the health benefits are. And you can see there's obviously been heavy activity in California with the NPOs, but also the Nashville Regional Transportation Planning Area has implemented, was an early adopter of ITHIM, the state of Maryland, Delaware, Massachusetts, and Vermont, which is interesting because that suggests that even small jurisdictions, Vermont only has a population of about 600,000 people. So even small jurisdictions can find a use of the tool. And also on the map, there's a number of flags planted where there are research collaborations at the University of Wisconsin, University of Texas at Austin, and UC Davis are research hubs where some of this development work has happened. What I'd like to do is to switch over now and talk about some of what Linda had talked about earlier, is what the health impacts of the ITHIM model. What are some of the research findings? So what I have on the left side of this graph is the burden of disease in California, but I've simplified it just to represent the number of annual deaths due to those 3 main pathways I spoke about earlier. You have physical activity, PM 2.5, and road traffic injuries. So these, again, are informed by the best epidemiologic studies to tell us what percentage of all deaths are due to lack of physical activity. So this goes beyond what's in the transportation system. This is all sources of lack of physical activity and all sources of PM 2.5, not just from the transportation sector. And for the road traffic injuries, roughly 3,000 deaths per year is sort of self-evident. And what you can see on the x-axis is a progression of ambition when it comes to active transportation. This LCD stands for low carbon driving, and it basically is just saying that there's not going to be a change in the level of physical activity, just change in the fuel source. It's going to be electrified auto fleet. And this 31 deaths avoided per year reflects primarily PM 2.5 reductions. And what you see over the next series is this SESs is the collective effort of the MPOs, the 5 largest MPOs, and what their plans were saying as far as active transportation. And you can see through the green bar that there is a net positive aversion of 800 deaths per year. And there's a tiny little red line that is positive, meaning that there would be a slight reduction in road traffic injuries. But any red line below the 0, which is this line right here at the very base, indicates an increase in, or projected increase in road traffic injuries. So you can see through the different state plans that there is big benefits and increasing benefits with increasing levels of active transportation. So remember, this CARB goal is quadrupling walking in transit and a 9-fold increase. So that's a significant increase in the amount of physical activity per person in the state. The US Surgeon General has the most ambitious goal and the most number of deaths avoided. So when we look at the number of deaths avoided just through the active transportation and compare it to what the overall profile is, we get a sense of what kind of public health impact the transportation system can really have in reducing the overall burden of disease in California. And some of these scenarios, granted they are ambitious and aspirational, at least we know that if they were implemented, they would have a huge impact on population health. So again, I'm going to talk a little bit about the findings of research studies. We just saw that the state agency goals and plans fall along a wide spectrum of deaths avoided per year. And also, I didn't show it, but potential carbon reductions as well, that US Surgeon General could be reducing as much as 18 million metric tons of carbon per year by substituting, with the assumption that those miles that are increased by walking and transit have a concomitant decrease in car travel. So that's one of the major assumptions there. When we monetize the benefits across that spectrum that you saw, it goes from about $1 billion to $67 billion per year. And again, that's using the value of a statistical life. That's the same regulatory approach that's used by US EPA and state agencies to quantify the benefits of particular intervention strategies. We also saw that the sustainable community strategies really rank pretty low as far as ambition, as far as increases in active transportation and the ability to have a big health impact. While every avoided death is welcome, we can still see that there's plenty of room for improvement in those plans. You should also point out that the model projects, in some cases, a net benefit, but that it includes an actual increase in bicyclist and pedestrian injuries. And that's a real safety alert, because we know that people will not take advantage of active transportation if they feel their lives are at risk. So even though we can't blithely say, oh, there's just a net benefit, that's with the recognition that some people are going to die, I think we need to take extra efforts to increase safety, to make those physical activity benefits available to everyone. The other thing that we see pretty consistently, not only in the California data, but from health impact assessments from around the world, when we look at active transportation as well as other pathways, we see that it is really the physical activity pathway generates far more benefits from air pollution reduction. And that's largely true in Western societies. When it comes to other places around the world that have a much higher baseline level of air pollution, that begins to eat away at some of those benefits. But it's really a testimony to the decades and decades of work of ARB and others to reduce the air pollution burden in California. The other thing that we see from the model is that plans and goals that emphasize cycling achieve both high health benefits and carbon reduction. So that's really a call out for the role that bicycling plays. And now with e-bikes, it'll expand the population who will be able to take advantage of that. So what I'd like to do now in the last few minutes is really just give you a brief presentation of the model itself, so you can get a flavor for it. It's a free open source application in a programming language called R, which has become very popular on university campuses, which means that there's a pipeline of folks who can potentially support this kind of work. And it's available for desktop computers and all the popular browsers. Unfortunately, it's not designed for smartphones or tablets. It will look a little bit weird, but anyway, if you have a laptop or a desktop, it should work just fine. Also, you can download it. You can not just have it on the web, but you can actually download it to your own desktop and run it that way as well. There is extensive documentation available, and you can there's a user manual, there's webinar slides, there's all kinds of things that you or your staff can take advantage of to feel proficient in using the model. The website is organized in a way that begins with a framing of and background information, much as I did earlier on, talking about climate change and the health impacts. Then it moves to describing what the scenarios are, again, the built-in scenarios that I described earlier. And then the heart of the tool is this run ITHIM. And that's where the user actually gets to interact, select a number of options, and get output instantaneously. So as we move from problem discovery or introduction, we want to link people with solutions. So this next part is decision support, where there's a wealth of information on the health outcomes to contextualize the findings in terms of the overall burden of disease in California, strategies for increasing physical activity, reducing VMT, and reducing air pollution, what the scientific evidence is for these outcomes, and data and resources. The user support has videos and all kinds of things to support people as they learn how to use the model. So what I'm going to do right now is just going to run this actually locally on my machine. And this is our website, the Integrated Transport and Health Impact Model, or California ITHIM. And here we have home, about, run ITHIM, decision support, and user support. So the home page has this the tagline, transportation planning for health equity and climate change. Gives a little bit of background on what the model does, its impact. Here's a gallery of some of the findings that have been published in peer review literature for folks, as well as the sponsors of the website. The other parts are the about, again, gives an introduction, gives instructions, it gives what, again, it repeats what the scenarios are in brief, gives what the geographies that are available, the time periods that are available, and methods. I just want to point out that the model is not static. It moves along with the California population. Most people who do transportation planning project out over a 20 or 25 year future period. So the model actually adjusts the population and the burden of disease to approximate what we believe will be the population and their burden of disease in the future. So this is consistent with how transportation modeling is done in California. So it syncs up nicely with what MPOs are doing as well. What I'd like to do right now is just give you a very whirlwind view of the model, and you can see what we have to start with. Okay, actually, let's see, we start over here. There are a number of different outputs. So when you come to the ITHIM tool, you get to see the left side is where you make your selections, and the right side is where you get your outputs. So there's a number of pick list drop downs where you again see here are the scenarios. Here's the scoping plan, the Caltrans strategic management plan, the sustainable community strategy, US Surgeon General, and here comes those what if scenarios. And at the very bottom, it allows users to upload their own data. And that's primarily for MPOs and others who run transportation demand models so that they can provide their own data. And now we have a mechanism for people to upload data that is stratified by race, ethnicity, and income. Because as Linda mentioned before, there's a strong commitment on the part of ARB and CDPH to understand the equity dimensions of our transportation plans and strategies for mitigating carbon. So whenever you pick one of these scenarios, you get a little brief synopsis of what the scenarios are. So you have some idea of what it is that it does. And here, the next selection is geographies. So the first thing you see are the major regions, which correspond to the MPO geography. So the Sacramento one is the counties that make up SACOG. San Diego County is its own SANDAG. San Joaquin Valley is the collection of 8 counties that make up the San Joaquin Valley, although they're not functioning as a single MPO, but they are a region. And the San Francisco Bay Area is MTC, and SCAG region is reflected there. You can do county level analyses if those counties are within those MPO regions. Okay, so there's about 30 choices that you can make there. And again, the time periods are in 5-year increments that go all the way up to 2050. So you can do transportation planning there. I want to point out what the outputs are. You get this nice little elevator pitch. That's the default report. And it is like what they call a blue button report, because as you change the scenario or the geography, the data automatically reflect what your choice is. So for those who just have just a minimal amount of time, if you want to get a flavor for what's going on, they can use the report. There's an infographic. Our users in developing this, we had a number of users who said they'd really like an infographic that would be a pictorial representation of the scenarios. And what we have here is whatever scenario is picked, it's juxtaposed with the US Surgeon General, which is really the optimal physical activity scenario, and low carbon driving, which is the optimum carbon reduction scenario, just to see where your particular choice fits in. And you can see years of life, health cost savings, lower pollution levels. These are all in a nice little infographic for people who want to communicate that way. The heart of the model is really the tables, and they're arranged in series of 5 or 6 tables that present a summary, and it goes through the travel patterns, goes through the health outcomes, as well as the monetized costs and carbon reductions. So again, depending on the user's level of sophistication, they can use these tables to help explain what the impacts of the different scenarios are. For example, if you took baseline multiples and you wanted to double, triple, and quadruple transit, you'd get a output that would reflect that choice. Okay. Lastly, we have graphs, and these are just representations of the same material. You can save the outputs by cutting and pasting, or in the case of tables, you can actually download the tables as CSV files, which allows you in Excel to manipulate the tables and represent them in any way you'd like. So I know this is a whirlwind tour of the tool itself. As I mentioned previously, there's lots of information on best practices in the section, the evidence for those practices. Susan Handy's white paper on VMT reduction has been reproduced in a table there. So again, it's recycling a lot of state documents actually that support efforts to reduce VMT, reduce carbon as well. And lastly, just point out that there is a lot of user support information. You have a quick guide to the website, you have video tutorial, you have an extensive user's guide. It's almost over 100 pages. You have chart books, and you can download the model itself and use it on your desktop as well. So with that, I'm just going to just point out that there's a number of publications and the peer review literature already on the model, and that this was not just my effort, but a whole team of folks at UC Davis and folks at CDPH and ARB who really helped shepherd this project. So with that, let me just conclude.
Thank you, Neil. And thanks everyone for staying on. We could just do a few minutes of questions. We're already over a little, but thank you, Neil, for that great overview. One of the questions that's coming through a lot in different ways is whether this can be transferred to other places and how people can find out more about that. And maybe since we have not that much time, we don't have to get into the details about how that would happen, but how people could find out more information about making that happen.
Yeah, if you're interested in other places, meaning other places in California or other places?
No, other states, even other countries. Yeah,
well, they should contact me. I've taken the code for California and created a national version. It took me several months to do that, but it can be done using the structure of the existing code. As I've pointed out, the spreadsheet version has been adopted in several different states already. So they should just contact me.
Okay, and could you put the beginning slide up again, then people can see your email address, if that's how you want people to contact you.
Oh, sure, yeah, let me find it.
Okay, and then there was a question about whether any of the underlying data like CHIS and other data would be updated, and I feel like you might be able to explain better.
Yeah,
what makes that hard.
This is actually a really important issue. Perhaps more importantly than CHIS, it's actually the California Household Travel Survey, which is a linchpin for this project. And I've spoken to some of the folks who do the location-based services, Streetlight, which is one of the companies that uses location-based services, GPS. It's gotten a lot of play in the pandemic, looking at people's mobility patterns, but because it doesn't directly collect age, gender, race, ethnicity data, there's going to be some big problems trying to apply those data. So right now, it looks like the travel surveys still are going to be indispensable. So that's a question for Caltrans and CTA to really understand what the commitment is to having a new travel survey. The National Household Travel Survey is insufficient for California. Unless there is a big add-on sample, it just does not have enough observations to provide the age and sex breakdown of cycling and walking by county in California. And that's what we need to have stable estimates for the model. There are other kinds of efforts internationally to create models that use much more resource intensive and methodologically much more complex, using synthetic populations, very much the way that travel demand modelers use synthetic populations. But those efforts are only in a research stage, not available for widespread use in the United States yet. So it looks like we're going to be dependent on the California Household Travel Survey. Just has its own problems, which I can talk about offline. If that person wants to contact me, I'll go into the details.
Okay, thanks. And let's do one more, and then we'll wrap it up. There's a question about, could you explain a little more why the model predicts so few avoided annual deaths from PM 2.5 for the scenarios?
Yeah. Well, part of it is that the emissions profiles from cars is going to be decreasing over time. And it has decreased from its historical high levels back in the 50s and 60s. So part of the reason is that we've become a very sedentary society. We've had successful air pollution control programs, and they've really reduced the levels of PM 2.5 substantially in California. It's still contributing to the overall mortality and morbidity, but compared to physical activity, we're at a place in the 2 dose response curves where we're just getting more marginal improvements through increased pollution reduction through emissions, car emissions, whereas even small increments in physical activity will have huge public health impacts because we're at such a low point in that dose response curve. Many of these dose response curves are very, very steep when it comes to small initial increments. And that's where a huge amount of the physical activity benefit is. It is nowhere near the marginal level where we have with air pollution. So that's the explanation.
Okay. Well, I think we're going to have to end here. Thank you so much, Neil. This was a great overview, and I hope that a lot of people got a lot out of it and can go and explore the tool more themselves and let you know if they have other questions. And thanks, Linda, for your introduction and for your support. And thanks to everyone at CARB who's on the line for your support with this project and making this website happen. And thanks, everyone, for coming. We'll end this. If you are one of the about 19 people who are coming to our longer training after this, we'll take about five minutes right now, try to make it short, and we'll jump on and start the other webinar from the other link. We'll say goodbye. Thanks.
Thanks, everybody.